Hi, I'm Brian Miles. I'm a urologist, and I'm here to hopefully tell you everything you ever want to know about survivorship. Good day. It's a pleasure to be here and able to talk with you all about something that all people who have suffered cancer and have been treated for it care most about after being cured. And that's something we call survivorship. Survivorship in particular, after what I do, which is prostate cancer treatment, involves what's your life like after you've been treated. What does it mean to be cured of cancer? It means something good, but at the same time, it can be very challenging, when I say nothing, if your life is compromised severely. If you had spine surgery for spine cancer and became a paraplegic, that you feel better about not having cancer, but don't feel great about being a paraplegic. What we do when treating prostate cancer can lead to, in particular, problems with bladder issues, not able to control your urine, and for male sexual function or not having a normal erection. There are potential erection issues, but these tend to be related more to radiation. Survivorship is honestly exploring life beyond treatment and what can we do to help you get back to the person you were before you were treated. We're looking to provide solutions for you to find your normal life back. There are a number of things that we do. If men have a problem with urinary control issues after I operate on them, I have associates who can correct that. This is not a very frequent problem, but for the one person it affects, it's 100% for them, and they need to know the solution. Physical therapy is very helpful, but also some minor surgical procedures can correct that completely, because being wet is miserable in life. For those men who have not regained their sexual function, in my department we have special people called andrologists. Andrologists specialize in diseases that affect men, like low testosterone or erectile function or infertility. Low testosterone requires hormone or testosterone therapy many times, and these colleagues of mine help men get their testosterone back to normal, which can also help them get normal erectile function back. And there are many solutions for this that people can avail themselves of through an andrologist. I do a fair amount of research in this area. I've got 2 ongoing protocols right now, one using a technique called shockwave therapy on the penis. We actually induce an injury to the penis, which sounds kind of strange because why would you injure something that's already broken? And the reason is that these shock waves create an injury that the body sends stem cells in to heal it. Those stem cells build new blood vessels, new nerves that help heal the inside of the erectile body of the penis. There is some data showing that can be quite successful. It hasn't been studied, as far as I'm concerned, that well in men after a radical prostatectomy, which is what we do for cancer. I'm studying it in men right now who are between 6 and 18 months out from the surgery that I did, and treating them to see if we can get their erections back. And these have to be men who had fairly good erections before the surgery. We can adopt it for others who didn't, but that would be after we learn what the success rate truly is. Because right now it's cash pay in the community, and I don't want my patients paying for anything if they don't know what the success rate could be. If it's 10%, you probably wouldn't do it. If it's 90%, you probably would. So this shockwave therapy hopefully holds a lot of opportunity for patients in the future. I'm also designed a trial looking at electrostimulation for urinary control. These are devices which are used for pain control, but they also have a role in muscle stimulation. And so I'm using what's called a TENS unit, transcutaneous nerve stimulator, to see if I can improve urinary control for men who have really minor leakage, but annoying leakage, a thin pad per day, These are things that some preliminary data from colleagues working on other problems found happened in men who had their prostates removed and had minor urinary leakage issues. So I'm very optimistic and hopeful that this will bring back again normal life for a patient with minimal intervention. I'd rather avoid even minor surgery for this issue if we can correct it using a very simple and painless device to help the man get their control back. Thank you for taking the time to listen to this brief talk. Hopefully I've stimulated you enough to look for the solutions that we can provide to make your survivorship a reality.